My name is Shazhan Amed. I'm a pediatric endocrinologist, first and foremost. I've spent my entire career at BC Children's Hospital in the great city of Vancouver, and so have spent, over 20 years caring for kids living with diabetes and their families. The problem that we're trying to solve and have been trying to solve for a number of years is that data is underutilized in the healthcare system. And the reason for that is that it is siloed, difficult to access, and it exists in all these different places. And this applies across the healthcare system. But for people living with diabetes, this is really relevant because of the advances in diabetes technology, where patients are wearing wearables like glucose sensors and insulin pumps and generating data all the time through those wearables. And they can't easily access that data in sort of aggregate or with insights. They have to go to all these proprietary, websites. And then, they generate data in the health system every time they see a doctor or a nurse or they're, hospitalized. And that data is very difficult, if not impossible, for them to see, to help them in their own self-management. And clinicians themselves, can access data, but it's all in different places. And so the time that it takes, the administrative burden of that, but most importantly, the fact that we can't see as clinicians all of the data in one place, which really limits our ability to provide holistic care. We actually can't leverage what's happening in the world today when it comes to innovation, and that's artificial intelligence. And how can we use that to improve the lives of our patients? We built a product, we deployed the product in a pilot study at the BC Children's Hospital Diabetes Clinic, and it was very promising. It was only in 19 families, but what families said that they felt connected, that accessing their information, whether it's their glucose data or their clinician's recommendations from their clinic appointment, or getting tasks and forms and things to complete before clinic, help them feel connected, more prepared, empowered, and they really enjoyed that experience of seeing their information in one place. Clinicians really appreciated and enjoyed having all of their patients' data in one place and having the ability to collaborate with these patients, on their data. And that's what that product offered. And our first task is to train predictive machine learning algorithms that will predict a poor outcome before it happens, like a hospitalization for DKA in 90 days, predict that before it happens, a rising A1C in 90 days. Once those machine learning algorithms are validated, we will apply them into the back end so those flags can actually go directly to the patient and the clinician in their front end interface, where they can then take action before that poor outcome happens. And so our goal is really to shift our healthcare system from providing sick care to preventative care. And at the end of the day, save the system health dollars that can be deployed elsewhere for preventative medicine.